Hi, my name is Dr. Cronkite. I wanted to intro the law of pre-existing conditions training that I'm about to do for you. Look, I'm going to show you the easiest way to navigate pre-existing conditions, bar none. But the biggest thing I want you to understand is it's just a part of an injury practice, right? So the biggest thing that I want to relay to you is that information like this is important to make it so it's easier to navigate a personal injury practice. But right now, it's really important to increase your personal injury practice. I'm making this video, I think, May 10th, 2022. Whether you realize it or not, we are in a recession. We're in a recession, and it's going to get a lot worse. Practices, I will predict that at least 20% of the practices that are in existence today will not be here 3 years from now. At least 20%, maybe more. Because it's going to get bad. The area that's not going to get bad is injury work. So I put out all kinds of free information. This is a free training. If you follow me, and how you follow me is you follow me either in the Smart Injury Doctors Practice Building Success Secrets site. You follow me on our podcast, the Smart Injury Doctors Podcast. We're on Apple, we're on Spotify, we're on Google. We're on a lot of different platforms. You can look us up, listen to this information. I put out a lot of free information. This one right now is on pre-existing conditions, and it's really going to simplify it for you, so I hope you enjoy it. Okay, welcome to this program, the Law of Pre-Existing Conditions. What I'm going to do for you in this program is I'm going to make pre-existing conditions practically go away for you. They're so darn easy, and they're so misunderstood. Now, they're misunderstood because you don't understand the law or the terminology. And then two, you don't understand the injuries themselves, which I'm going to cover very briefly so that I can basically give you a good educational program on pre-existing conditions. Look, pre-existing conditions affects everybody. It affects you if you're a doctor of chiropractic. It affects you if you're a medical doctor. It affects you if you're the surgeon. It affects you if you're the pain management specialist. It affects you if you're the attorney. It affects you if you're the patient. And it just doesn't have to. It's too simple. So that's the way we're going to make it. For those of you that don't know me, look, I'll start off by saying, look, I'm a father, I'm a husband, I'm a grandfather, I'm a kid, I'm a lot of different things. But in my professional career, I was also a licensed doctor of chiropractic for 31 years. I spent 17 years in clinic. I've been in the treatment rooms treating patients over 175,000 times. I then developed 2 national spinal ligament testing companies for support ligament damage, non-disc ligament damage. One was called, currently I'm the CEO of, called Spinal Kinetics. That's the largest medical testing service in the country for spinal support ligament damage. I'm also the chief designer of a thing called CRMA, which is the system that our radiologists use in spinal kinetics. And by the way, that's a trademark term. That's our trademark term for the procedure. And so if you're doing a CRMA, you're doing it with spinal kinetics. If you're doing it with somebody else, you're doing it with somebody that's not even supposed to be using that name. And what we do is we make sure that doesn't actually happen. So I'm also a published ligament injury researcher. I've also co-developed an AI that allows anybody to auto-detect for these types of injuries. I produced an online training program for doctors called the Smart Injury Doctors Program, an online training program for lawyers called the Smart Injury Lawyers Program. And again, I got my law degree in 2013. So I have this weird background. I do. I have a weird background that not a lot of people have. Not a lot of people have experience in all of these different areas. And to some degree, it makes me a little bit unique. Now, for this program on pre-existing conditions, remember I have a law degree. In my law thesis, what I wrote my thesis about was on pre-existing conditions. That's what I studied. So first of all, we got to know an injury. We got to define some terms so we're all on the same page. An injury is nothing more than a derangement to a body part. This is a fracture, deranged bone. This is excessive motion. This is derangement to a body part. This is disc herniation. This is derangement to a body part. This is burn. You see the derangement to the body part. This is a gunshot wound, derangement to the body part. Now we call the mechanism the force delivery system. This is the mechanism injury. This is the injury itself. All injuries are derangements of body parts. Now, when you say a pre-existing condition, we have to define condition. We're not using condition like, oh, it's in perfect condition. That is a condition. When we use pre-existing conditions in the healthcare market or the injury market, we're saying it's a defective state of health. It's something that's defective. It had a defect prior to, pre-existing prior to, having existed in an earlier time. Now, when we say a fracture, it's a bone injury. When we say disc herniation, it's a disc injury. When we say a spinal support ligament injury, that's an excessive motion injury. That causes excessive motion and spinal instability. When we use the term spinal instability, we're saying excessive motion in the spinal parts, which causes some form of nervous system dysfunction and or pain, often stabilized with conservative chiropractic treatment, adjustments, physical rehabilitation, or managed with pain management or surgically corrected through fusion surgeries. That's what it is. So now we're going to jump right into pre-existing conditions, right? So right here is an injury. This is a new injury, right? So I'm going to make up a story about this injury. Here's the story. The guy's actually, he's a mad gambler, and he owes two bookies a lot of money, and he's not paying bookie. Bookie number one shoots him with a 38 right in the shin. Now, the bullet goes in and is stopped by the bone. Doesn't go any further than the bone, and he has a bullet hole here. Hurt like heck. That's bullet number one, right? So he's got an active injury here. Now, let's say a week later, the other bookie blew a hole with a 50 caliber right here, but he lost the lower part of his leg as a result of it. Now, we have two injuries, two separate injuries. Nobody's going to say that, well, this pre-existing problem caused this new injury in a completely different area that had a completely different result to it. That'd be really easy to see. It'd be very easy to see. So that would be two separate injuries, and you would not have just two separate areas. Now, the reason why this is going to get important is because I'm going to start to separate the spine for you, because it's a big piece of real estate that has been compressed down to nothing. Now, we could say that I know you can't see this, that both these gunshot wounds would be lower extremity injuries. That would be true. That would be true. You could call them that, because that is a lower extremity. But nobody's going to go, well, gunshot 2 and the effect of gunshot 2, which caused the leg to be blown off, was a result of this. Nobody's going to make that assertion. Now, we have another way that we could have let's say we have this injury here. Bookie number one shot him here with a 38. Now, bookie number two shot him with a 38 through the exact same hole. Only this time it broke bone, and it went out the back of his calf. Now, we would have an active pre-existing condition that was aggravated, had additional injury to it, and all we have to do is list the original injury with the additional injury, and we have no problem with pre-existing condition. We're listing it out. Hey, this is what was the extent of this damage. This was the extent of the new damage in the same hole. Right? Now remember, if it's in a different part, it's a brand new injury. It has nothing to do with this as a pre-existing condition. So I hope that makes sense to you, because I'm gonna go over it again. But before I do, we got to understand the injuries. Spinal injuries. The biggest problem with with pre-existing condition problems is that the injuries aren't understood. There's only three main injuries any spine can have. You can either break it, because remember, a spine, as I'll show you, is just two tissues, bone and connective tissue. It's not the spinal cord. That's not the spine. Spinal nerves are not the spine. Spinal muscles are not the spine. The spine is the spine. It's bone and connective tissue. So you can either fracture it, cause support ligament damage, which causes excessive motion, or you can herniate the disc. Now, each of these are diagnosed differently. They're imaged differently. They're treated differently. And they have two very different symptoms associated with them. So again, bone and ligament, bone and ligament. There's 9 ligaments around the disc that are supposed to keep these bones in alignment so they don't become unstable, so they don't excessively move. And it's also to keep the disc in alignment. Remember, in the cranial-cervical junction, there is no disc, right? So we have these two distinctly different parts, two parts, bone and connective tissue. All injuries, doesn't matter where you get the injury, doesn't matter if you slip and fall in a public place, slip and fall at work, you actually go, you are in an auto accident, you're in a sports-related injury, or you hurt yourself at home, it's shear and compressive force that damages the spine. So it's kind of like this. Look, if I want to make this really clear, if I take a blowtorch and I burn the heck out of your right arm, and I do it at work, it's called a work injury. If I burn the heck out of it in your car, it could be called a car injury. If I did it at home, it could be called a home injury. The burn itself, the derangement itself, the injury itself is the same. Doesn't matter where you get it. It's the same. Same with spinal injuries. There is no different type of an injury in an auto accident than there is in a slip and fall. It's the same injury. The spine either fractures, causes excessive motion, or you got herniation of the disc, or combinations thereof. Right? So when we look at that, it's important to understand. Now, it's also important to understand that an injury to the human body doesn't care what office you walk it into. And that example of the burn, if I walk that burn into the dentist's office, that might not be the best place to go, but the burn is the same, whether I'm in a dental office, a chiropractic office, a medical office, a medical specialist's office, the naturopath's office. It doesn't matter. The injury is the same. It's same with spinal injuries. The injuries are the same. The injury to the spine that the chiropractor is working on, the physical therapist is working on, the pain management specialist is working on, and eventually, if it needs to, the surgery is working on, is the same condition. It's not any different. And all you have to do is understand them. Now, it's important to understand them, right? So we have two types of connective tissue damage. We have excessive motion to the support ligaments, the ligaments around the disc, and that causes excessive motion and also tears up. When you have this, you've now imaged the problem with the facet. The facet's one of the main pain-generating sources in the spine. And when you damage the support ligaments and they no longer can keep the alignment, you have this excessive motion, you have instability here, the facets are a problem. So all the pain management people, everybody in the market that's doing pain services and things like that are doing services on this injury, right? We also have the disc herniation. This one has far more symptoms than this one does, by far. If we look up a disc, pain and radicular pain. Pain and radicular pain. If we look up the other ligaments, all these other symptoms, right? So who in the world, if you walked in and said, look, I was in an auto accident, I think I got visual disturbances, I've got balance difficulty, I seem like I'm dizzy, and I'm getting really bad headaches, and my ears are ringing. That was your symptoms. That was your symptoms. In today's market, what would happen is they go, oh my God, I need an MRI. I need a cervical MRI to see where the discs are. Now, any patient that walked into a doctor's office with just those symptoms, you wouldn't probably get a cervical MRI. The first thought that the doctor has is, oh my God, it must be a disc herniation. That would not go through any doctor's mind, but yet that's what passes off today as good diagnostic testing in the spinal injury market. It's ridiculous. It's actually ridiculous, right? Remember, diagnosis is running the symptoms back to the most common tissue that would cause the problem. So if I walk into a doctor's office today and I say, oh, doc, hey, I'm getting some chest pains, chest tightness. When I walk up 5 sets of steps, I feel like I'm going to pass out. My ankles have been swelling really badly for the last 2 weeks, 2 months, whatever. Okay, any doctor's going to go, wow, you need to get your heart checked. That's the tissue. That's the organ that could be a problem. So they send me in. I do all the testing. I do everything. It shows my heart's 100%. Now we got to dig deeper. But you don't dig deeper until you started with the most common tissue that will cause this problem. Spinal ligament injuries that cause instability cause these symptoms, all of these symptoms, including radicular problems and pain. So we really have to look, if the person just has localized pain and radicular complaint, yeah, we could have just a disc herniation. But the chance of just the disc being damaged without the support ligaments being damaged around it are really rare. That's pretty rare. But we got to know the injuries. We got to know the three, right? Because we got to know, hey, look, if we've got a disc herniation, do we have excessive motion? Are these support ligaments damaged? Anytime I hear somebody's got a disc herniation, I go, okay, how about the support ligaments? What are they doing? Because that's a long-term thing. Everyone knows in the market that the more severe the injury is, the longer it usually takes to stabilize. But you have to show it, right? And you have to show what part has this injury. You have to show what part has the injury. It's really important. I'll show you. Look, if we have an auto injury here, we hit the pedestrian, his left knee is damaged. Left knee is damaged badly. Okay, we could call this a leg injury. That's fine. Pretty general. We could call it a leg sprain because it is. Just doesn't tell you where the hell it is or how bad it is. We could call it a lower extremity sprain. Same thing. Doesn't tell you what lower extremity sprain. What the hell does that mean? It's the hip joint gets sprained, the knee, ligaments, ankle, foot, toes. You know, what is it and where is it? It's not specific enough. That's just like saying, hey, they have a neck injury, or hey, they have a whiplash injury. This is just, it's just that specific. Right? Now we look and we could say, well, hey, we're going to take a full lower extremity x-ray. In some chiropractic offices, you would call that a full spine x-ray. Or if you took a neck x-ray, it would be no different than taking a lower extremity x-ray. If you take a neck x-ray, you're taking an x-ray of the full neck. If you take a lower extremity x-ray, you're taking an x-ray of the full lower extremity. Now remember, we got a bad knee injury here. Let's say on the full lower extremity x-ray, we saw severe degenerative change down in the ankle. Would anybody in the world say that, well, the severe injury that you got in the knee is from the pre-existing degenerative change in the ankle? Nobody would say that, right? Because you got long bones here, so it's fairly easy to see. But yet that happens every day in the spine world. Oh my gosh, you got degenerative change at C5 and C6. That's causing all the problems. That's ridiculous. It's absolutely ridiculous. Insane that anybody has a problem with that. And remember, there's one less joint in the whole lower extremity than there is in the cervical spine, right? So the cervical spine has even more real estate. It just doesn't have long bones in between the joints. So it's a little, it has the appearance of being harder to separate, and it's not. All right, now we're going to use another example. So I want to make sure that you're clear. Here's a car. Right? Now this car has some age on it, right? So as soon as a human body comes out of the package, it's not new anymore. It's growing, it's evolving, but now it's starting to have wear and tear on it. It's starting to have, how did you feed it? How have you treated it? What is the condition of your body? Right? No different than a car or a used car. But let's say we have this car, right? It's got some miles on it. It's got 40, 50,000 miles on it, whatever. And now somebody hits it. Okay, when you hit it, you derange the mechanical structure of the car. And some mechanic says the hood is damaged. This front panel is damaged. The light wasn't damaged. We can salvage that. And there really wasn't anything else damaged here. Right? So that's the extent of our damage. And guess what? We can't get you in for 2 weeks. We can't get you in for 2 weeks. So we got to tie down this hood. You can drive it just fine. Right? Okay, so the person takes it out. But let's say that a week later, they're hit in the same area. They're hit right here. Only this time, it springs the door, the hood wider. It shatters the windshield. It springs the door. And a main bracket that holds the engine is severely damaged. Now, do we have an active pre-existing condition? Yes, that means we have an injury, and now we have a new or more damage or new injury onto a pre-existing condition. But we also have additional damage that's documented that was not a part of the first injury. So all we have to do is we have to be very good at documenting what is damaged further. What's the new damage? What was damaged further? And it's very easy to separate. It's not hard to separate. Now, the other thing we have to do is we have to say, okay, now let's say that the guy who fixed it is a Bondo wizard. He fixed all this with Bondo. Looks great, but it's not nearly as strong as the regular parts that you would use. Is that a pre-existing condition now? Yes. Is it as strong as it used to be? No. If they were in another trauma here, would it probably be worse because the materials that were laid down here were not as strong? Yes. What do we call this? We call this a dormant pre-existing condition. It's not injured in any way, but if it were hit, it could be a lot worse. Now, that sounds easy. So let's go to the spine itself. Oh my God, we got degenerative change at C5 and C6. Oh, we got a major problem here. So let's learn the law, let's learn the terminology, and let's make this super, super simple. So first of all, we have this thing called an active pre-existing condition. That means the patient has a condition that's been determined to be the clinical cause of their problem that they're actively being treated for. So in order for this to be an active pre-existing condition, let's say the patient comes in, they have a whiplash, and they have eye pain, ear pain, facial pain, headaches, upper neck problems, upper neck stiffness, shoulder problems, mid-back problems. Okay? In order for this to be an active pre-existing condition, somebody would have had to say a week ago or 2 weeks ago or a month ago, hey, all of these symptoms that I just described are associated with this, and we're going to treat that. And now that's actively under treatment while you're basically being assessed for this new injury. So in other words, kind of think of it this way. Somebody would have to be able to say, look, this pre-existing condition, remember this isn't as strong, is the cause of this. No, the injury is the cause of this. So it's an insane thing to actually look at and even say, but an active pre-existing condition is something that's actively being treated and has the symptoms of what you're now asserting is an injury case. I hope I make that clear, because the majority of cases you have are not active pre-existing condition cases. They're dormant pre-existing condition. It means that you have this condition, just like the Bondo in the car. At some point, this person had an injury. That's what's causing this, right? The body's putting it back together and it's trying to fuse it, right? So it is a dormant pre-existing condition. It's like the Bondo in the car. It's not active. It's not causing. It wasn't being actively treated. It wasn't diagnosed as the cause of whatever the patient is suffering for now. And remember, it has to be the exact same thing. So if your patient had all these symptoms, somebody has to try to say, this is the cause of all those symptoms. This doesn't cause headaches, right? Damage up in here does. Damage up in here does. So remember, just like the car example, right? We have a dormant pre-existing condition here. It's not active. So we have this term called proximate cause. We got to resolve this. It's just a simple one. I'm just going to throw it in. Proximate cause just means that the accident and the event caused the problem, and there was no chain to break that. So as an example, here, I'll give you an example. So a patient comes into me, real life story, comes in to me and says, hey, Dr. Kronk, I was in an auto accident about a month ago. I didn't damage my neck at all. But this last weekend, I was up on my roof of my garage. I was re-roofing it, and I fell. I fell off the roof. Thank God I didn't kill myself, but I fell on my shoulder and my neck, and my body weight just crunched it. I thought it broke my neck, and I am in serious pain. I have serious problems with it. I don't have insurance. Can we just run it under my auto accident? The answer would be no. Obviously, no. There's a proximate cause. So the term proximate cause means a cause which is the direct sequence, unbroken by any new cause, right? So that's all proximate cause is. Proximate cause is the easiest thing in the world. Some attorneys will say, oh my God, we're so worried about proximate cause or the cause. Can we identify the cause? Yes, because you identify the mechanism of injury. Remember, there's a mechanism, force delivery system. Now we have to just know what the injuries are. We're going to show the injuries in our workup. So that's all I want to say about proximate cause. In Gilbert law summaries, this is what we all use in law school. It says as long as a chain of causation is proved, any sort of hospital, medical, or other therapeutic care is recoverable. Now let's study some federal law. because federal law is going to help us to understand this even better. Maurer versus the United States said it is a settled principle of tort law that when a defendant's wrongful act causes injury, he's fully liable for the resulting damage, even though the injured plaintiff had pre-existing condition that made the consequences of the wrongful act more severe. He's got a car. That car, it's got Bondo. We redid, old problems with it with Bondo. Now he's in a completely new injury. You take the injury, the damage, and you don't discount it because he had a problem with this car in the first place, inferior parts, that caused the new trauma to be even more traumatic. I don't think I can make it any clearer than that. So that's good. It says a plaintiff's recovery for damages caused by a defendant's wrongful act may not be proportionally reduced because of pre-existing weakness or susceptibility to injury, such as an osteoarthritic condition or a weakness caused by a previous injury. Couldn't get any clearer. Now, it says, however, there's always two exceptions. So here's the exception. First, when a plaintiff is incapacitated or disabled prior to the accident, the defendant is liable for only the additional harm or aggravation, new term, aggravation that he caused. Aggravation is a new injury on top of a pre-existing condition. So remember, let's go back to the car, right? So if I have this, and this isn't fixed, I have an active pre-existing condition. I'm going to get it fixed 2 weeks from now. I take it into the shop. But a week later, I get hit here, and now there's additional damage. There's additional damage. And there's additional damage to the pre-existing problem that I had, right? That additional damage to the pre-existing problem is called an aggravation. The new damage is new damage. It's new injury. It's new damage. But the worsening of the already existing damage is called an aggravation, right? So we want to make sure that we understand that, right? So it's called an aggravation. So it says the first exception is when somebody's disabled. So they're quadriplegic. I'll make it very dramatic for you. They're quadriplegic. They're wheeling in their wheelchair and they get hit in a crosswalk by a car, right? And they injure their head. They injure their arm. They injure their hand. Okay, well, the party at fault for that injury is only responsible for the head, the arm, and the hand injury. They're not responsible for the incapacitation or the disability that was caused by some other event. That should be super, super clear. Now, let's make sure aggravation is a worsening of a pre-existing condition. It's a physical, chemical, biological, or other factor which results in an increase in symptoms, signs, or impairment. Impairment, defined easily. All impairment is loss. If I cut your arm off, you've lost your arm. That's loss. That's also a hell of a derangement. Loss of use of, I cut the nerve to your arm. That's also a derangement to a body part, which is the body part is the nerve, and I've lost the use of my arm. So loss of use of, or derangement. What's a derangement of any body part? It's an injury, or derangement of any body part, organ, or organ system. That's what impairment is. So this is a worsening of a pre-existing condition that never returns to baseline, or it's very slow to return to baseline. So you can tell an aggravation of a already active pre-existing condition. Remember, an aggravation to an active pre-existing condition can be that, but you can also have new injury on top of that in other areas, just like the car, right? So, basically this aggravation, if all you had was an aggravation to this body part and you had additional damage to it and it never returned to baseline. So let's go to the gunshot wound. All right, right here. Okay, so active pre-existing condition. Put another bullet hole through here. Does more tissue damage. So we have an aggravation to the active pre-existing condition, and we have additional injury. Now, when we have an aggravation to an active pre-existing condition, it can take a lot longer for that to heal or reduce, or it may not ever heal as well as it would have if there would have only been one bullet hole in it. That's what that means. right? That's exactly what that means. So we look at, that's what an aggravation is. And again, you can freeze frame this, you can read the definition, take a look at it. An exacerbation is a temporary worsening. So your patient's under treatment for low back. You got them a month, you're doing correction work, they do great. And now they say, oh, you know what? I'm going back to the gym. They go back to the gym, they try to do they try to do deadlifts or, squats like they were doing a month or two before. They come back in and say, oh my God, doc, my back is so sore. And it's sore for 2 days, 3 days, a week. And it's right back down to baseline where it was. That's an exacerbation. That's not a new injury. That's an exacerbation. Right? So when we take these rules, remember, rule 1 is you only, the person that injures a body, if the person is already incapacitated or disabled, they're only responsible for the additional injury. Second, when a plaintiff has a pre-existing condition that would inevitably worsen, a defendant causing subsequent injury is entitled to have the plaintiff damages discounted to reflect the proportion of damages that would have been suffered even in the absence of the subsequent injury. So what that means is that if you can prove that this would have caused every single problem that the patient had with the auto injury now, and it would have caused it because it would have progressed to have caused it now simultaneously at the exact same time that this all lit up, then you can discount it. But guess what? The burden of proof in such cases is upon the defendant. The insurance defense has to prove that. No one can prove that. So it's a very large uphill battle. So let's take a look at some Supreme Court law in a state. This is pretty much the same in all states, but I'm just pulling this up because it does communicate it really easy. So Washington state courts have held in the past where there is no evidence of pre-existing condition is causing pain or disability close to the time of traumatic injury. What is that called? That's called an active pre-existing condition. But they're not, so they're saying basically there is no evidence, so it's a dormant pre-existing condition. Is sustained. The at-fault party is liable for 100% of all subsequent treatment bills damages when the incident lights up the dormant or asymptomatic condition. In other words, when an abnormal condition is present but inactive and not requiring active care, there's nothing that requires any apportionment of the injuries or treatment caused following the new trauma. The trauma is solely responsible from a medical legal perspective. The rule is that when the latter condition itself does not cause pain, the latter condition being the pre-existing condition, does not cause pain, suffering, or disability, but that the condition plus the injury brings on pain, suffering, or disability by aggravating the pre-existing condition and making it active, then the injury and not the dormant condition is the proximate cause of the pain and disability. Thus, the parties held for the entire damages. So let's make it practical. Hey, we're in here now. We're in with our patient. We do a consult. We look at the patient. We say, look, do I think she broke her neck? No. So if she has neck damage, it has to be the connective tissue. So they got support ligament damage, which is excessive motion. We can easily test for. And I can test for where is it and how bad is it. And then I kicks in all my guidelines and all my drivers for everything. Kicks in athletic return to play parameters, kicks in surgical guidelines, kicks in impairment guidelines, kicks in treatment guidelines, clicks in the ability to grade the severity of the ligament damage itself guidelines, kicks in everything, right? So I'm going to do a history. I'm going to get all the symptoms. The symptoms are going to start to tell me whether I got just a disc herniation or whether I got other damage. I'm going to get out, rule in, rule out any pre-existing conditions. I'm going to find out about gaps in care, if there were any gaps in care. I'm going to find out about what the person can do, what they can't do, what they're having difficulties doing. I'm going to be explaining to the patient what I'm going to be looking for in my exam and how this is one of the most significant conditions, especially the excessive motion condition. And I'm going to explain to the patient that this often goes undetected. It's not going to go undetected in you. We know exactly what the injuries are. And when you work with doctors that don't know what the injuries are, that's anybody you know that has any kind of chronic pain, chronic low back pain, chronic neck pain, chronic headaches, has a condition that we're going to look for today on you that has been undiagnosed. That's why they're not getting any help with it. So you even start the referral process. You're going to do testing, right? You're going to start to test, and you might do some motor or sensory testing that starts to identify the exact level that might be compromised. You're going to do some testing where you're actually feeling, is there pain or inflammation, especially inflammation intersegmentally. That drives all your x-ray guidelines. You're going to take great stress x-rays. You're going to do great measurements with those x-rays. And I'm going to tell you that, in our world, you send out to a board-certified medical radiologist to have these studies done. And it can be spinal kinetics, it can be anybody. But you want to have it accurate. You want to know what the hell an excessive motion study really is and what it should look like. Because you have doctors out there and radiologists out there that put hey, I see 2.1 millimeters of translation at C4 and C5. That is not an excessive motion study. Now, the reason why they're not done is because the majority of radiologists, they don't have a system to do it. And it's also very time consuming, so they don't do it. That's why we automated the program when I said we created an AI, helped to create an AI to do it. So you want to have this. You look at this right away and you say, wow, there's excessive motion here that's severe enough. And what segments? Right here, in these two segments. That is severe enough for a spinal fusion surgery to occur if it's not stabilized with conservative care. So we look at this. I apologize. This is an old report and an old slide, and it shows up fuzzy. But let's take this degenerative change here, right? Well, this degenerative change, when you have this is going to be a stiffer joint. So the forces, remember, it's a compressive and shear force. The forces are going to do more damage in the healthier joints, which is exactly what this person has. So they have severe ligament damage, severe enough to cause enough instability that could cause the patient to need a spinal fusion surgery if it can't be stabilized with conservative care. Remember, chiropractors are going to adjust this and do other procedures with it. Physical therapists are going to adjust it and do other procedures with it. That's the conservative care level, most common. And then if not, it goes up to pain management. If not, it goes up to surgical. So this case right here shows an injury. There is no pre-existing condition here. Remember the leg and the ankle? Well, this would be like the ankle. This would be like the knee. This would be like the hip. These parts are separate. They're very separate. And when you condense them down, you basically condense it down to the doctor that says, well, what do you got? Well, I got a neck injury. Hey, your kid comes back from a bad soccer injury. They're laid up. Their leg is hurt so bad, and their doctor says, well, you say, what's the problem? They got a leg injury. No one would go, oh, wow, that's pretty sophisticated. Well, they have a cervical sprain. All right. That'd be no different than the doctor saying, hey, they have a lower extremity sprain. There's nothing accurate about that. So the more you understand the injuries, the less you have problems with pre-existing conditions. Because it'd be like if the car auto mechanic or the collision people didn't know the separate parts of a car. So they just said, well, he's got front end damage. Well, what happened on the second accident? Front end damage. Oh, well, the front end damage was from the first accident was the cause of all that front end damage from the second accident. How are you going to distinguish it? You got to know your parts. And when you know your parts, it's insanely easy, right? Person fall at work, fall in a public place, auto accident, any of these areas. They injure their spine. They either broke it, support ligament damage, which causes excessive motion and spinal instability, or herniation or combinations thereof, right? About 30% of the people that have these, remember, 55% of the people that have a ligament injury don't ever fully recover. That is not a patient issue. That's a doctor issue. That's bad doctors, not bad patients. So about 30% will have a condition severe enough that it will cause the knee, just like in this one, C3. Under the surgical guidelines, flexion extension radiographs demonstrate instability at the following levels: greater than 11, we've got 17, and this is to determine the medical necessity of performance of spinal fusion. You don't do this surgery for disc herniations. You do it for excessive motion injuries. So this stuff becomes pretty simple. This is what a new spinal kinetics report looks like. So if I look at this new report, right, I look at it and say, wow, I got severe ligament damage in the craniocervical junction. I've got a rateable angular finding, in this case at 20 degrees, qualifies for spinal fusion surgery. It's a grade 3 ligament injury. It qualifies for a 25% whole person impairment in the impairment guidelines. It qualifies for if the person is in any kind of athletic activity where there's any kind of contact, jiu-jitsu, kickboxing, football, you got to restrict their participation in that, because they could seriously cause further injury if they got another injury on top of that. So that's, kicks in all these guidelines. And these guidelines, no, I'm not making them up. These are the guidelines that have been there forever. I just know them, right? And I know to use them, and I know to use the separation of parts, right? So pre-existing conditions become insanely easy. But you got to understand the terminology, and you got to understand the injuries themselves. And then they're really easy. Now, what I'm going to do now is I'm just going to tell you about some free resources that we have. First of all, we have this incredible free resource. We put out so much information in this resource. It's free. It's called Smart Injury Doctors Practice Building Success Secrets. I don't care if you're a medical doctor, if you're a chiropractor, you're a medical specialist, you're an attorney, you want to be a part of this. So just search it out. Ask to become a member, and we'll include you in as a member. We have Smart Injury Doctors Podcasts. It's where I do 9 to 12 minutes, usually on a particular topic. You can listen to them in your car. Spotify, Apple, Google, the main podcast accounts, we're in. So just look us up, Smart Injury Doctors, and you'll see it. If you want to find out more about our program, 800-940-6513, or you can go out to our site. Better yet, you just go out to our site. You say, hey, I want to learn more. Put in your name and your email address.
Hi, my name is Dr. Cronk, and I'm the founder of the Smart Injury Doctors program.
And then look at our program. Watch our program overview. And first of all, look at what other doctors have said about us, about what we do. Right? This market is wide open. Watch a program overview as your next step. In the program overview, you'll watch about a 40-minute video where we actually show you exactly what we do. Now, you can then schedule a consult. You just hit schedule a consult. You're right in Isaiah's or Chrissy's meeting calendar. You can also, let me get back to where I was. You can also check out the Smart Injury Doctors podcast. Good. You can start looking at our podcast. You can also join the group. This is where you just join the group. Put in a, hey, I want to join this group, and become part of the group. Again, we put out all kinds of free information in that group. So that's what you want to do. That's how you get involved with us. Right? Again, any questions? 800-940-6513. Doctors, I hope, doctors, lawyers, who's ever listened to this, I hope I demystified this thing of pre-existing conditions. You got to understand the injuries. If you don't understand the injuries, you're already lost. If you understand the injuries and you understand the language, you will never be lost. It's the easiest thing in the world to navigate. And when you can navigate it as easily as I've showed you, you become a huge resource for attorneys, huge resource for insurers, huge resource for everybody. And that's what we're trying to do. So, doctors, I thank you for your time and your attention, and I hope you got something out of this. Thank you.